Good evening, sir. Good evening, everybody. I'm Feba Susan George from first year MSW, Christu Jayanti College. Today, I'll be presenting on the topic Challenges of Implementing Group Work in Medical and Psychiatric Context. Group work has become an essential component of therapeutic interventions in various healthcare settings, particularly in medical and psychiatric context. This approach allows individuals to engage with peers who share similar experiences, fostering social support and facilitating personal growth. However, implementing group work in these settings presents several challenges ranging from diverse patient needs to logistical issues. Understanding these challenges is crucial for healthcare providers aiming to optimize the benefits of group interventions. Now, before moving further into the topic, I'd like to give a brief introduction on what social group work is. Social group work is a method of social work that uses group settings to help individuals improve their and social well-being. Through organized activities and guided interactions, it enables members to develop skills, gain support, and work on common goals in a collaborative environment. The social worker or group facilitator plays a key role in creating a safe space, encouraging participation, and guiding the group process. Next, I'd like to give an introduction to the medical and psychiatric settings. Medical settings. These environments primarily focus on treating physical ailments and health conditions. Group work in medical settings often includes support groups for chronic illness management, rehabilitation programs, and psychoeducation about illness related topics. The goals are to help patients adjust to their conditions, improve adherence to treatment plans, and foster a sense of community among those facing similar challenges. Psychiatric settings. In contrast to medical settings, psychiatric settings addresses mental health disorders, providing treatment and support for conditions such as anxiety, depression, and psychosis. Group work in these contexts can include therapeutic groups, psychoeducations, and support groups aimed at enhancing social skills and emotional regulations and coping strategies. The primary objectives include reducing psychiatric symptoms, improving social functioning. Now, I'd like to talk on understanding group work in medical and psychiatric context. In both the medical and psychiatric settings, group work serves as a valuable adjunct to individual therapy. It provides opportunities for patients to share experiences, gain insights from others, and develop social skills in a safe environment. Effective group work in these contexts requires a nuanced understanding of the unique needs of participants, including their emotional, psychological, and physical challenges. This understanding is crucial for designing appropriate group interventions that are sensitive to the diverse backgrounds and needs of group members. Now, I'd like to discuss the major challenges in implementing group work in medical and psychiatric settings. The first point, heterogeneity of group members. Participants in group work often come from diverse backgrounds, presenting various diagnoses, symptom severities, and personal goals. This diversity can complicate the facilitation of group dynamics and limit the effectiveness of interventions. The second point, patient stigma and resistance. Stigma surrounding mental health conditions and certain medical issues can lead to resistance among patients. Some individuals may feel uncomfortable sharing their experience or may fear judgment from others, which can hinder their engagement in group discussions. Third point, ethical and confidentiality issues. Maintaining a confidentiality in a group setting is critical, especially given the sensitive nature of the discussions. Ethical dilemmas may arise when handling personal information shared by group members, requiring facilitators to establish clear guidelines for confidentiality and informed consent. The next point, communication barriers. Language differences, cognitive impairments, and cultural nuances can pose a significant challenges in communication among group members. These barriers may prevent effective participation and limit the overall therapeutic benefits of the group. The next point, facilitator challenges. Group facilitators must possess specialized skills to manage diverse needs and facilitate discussions effectively. The emotional burden of addressing conflicts or crisis within the group can also lead to facilitator burnout. The next point is logistical issues. Practical considerations such as scheduling conflicts and physical accessibility can hinder participation in group discussions. Ensuring that group work is convenient and accessible for all members is crucial for a successful implementation. The next point, managing group dynamics. Facilitators must adapt at navigating complex group dynamics, including addressing disruptive behaviors and fostering a cohesive group atmosphere. Ensuring that all members feel valued and heard is essential for maintaining engagements. I'd like to discuss some of the strategies to overcome all these challenges. The first strategy, tailoring interventions. Facilitators can design group activities that accommodate diverse needs of participants, creating smaller subgroups based on shared experiences or similar diagnosis can enhance engagement and effectiveness. The second strategy, addressing stigma. Promoting a safe and non-judgmental environment can help reduce stigma. Using psychoeducation to inform participants about the mental health issues can also empower them to engage more openly. The third strategy is ensuring ethical practices. Establishing clear group norms and confidentiality agreements can help maintain trust among members. Facilitators should regularly revisit these agreements to reinforce their importance. The next strategy, facilitating effective communication. Using assistive technologies or simplifying language can enhance communication in diverse groups. Facilitators should be trained to recognize and address communication barriers proactively. The next strategy, enhancing facilitator skills. Providing ongoing training and support for facilitators can help them develop the necessary skills to manage group dynamics effectively and prevent burnout. The next strategy is addressing logistical barriers. Flexibility in scheduling, including offering online or hybrid group formats, can accommodate various patient needs. Collaboration with community organizations can help address transportation and accessibility issues. The next strategy is strengthening group cohesion. Implementing structured activities such as icebreakers and team building exercises can enhance group cohesion and encourage participation. In conclusion, implementing group work in medical and psychiatric contexts presents various challenges, including diverse patient needs, stigma, and logistical issues. However, with a thorough understanding of these challenges and the adoption of strategic approaches, healthcare providers can effectively utilize group work to enhance patient outcomes. Group work not only fosters social support and learning, but also promotes healing and recovery both in medical and psychiatric settings. Thank you.